According to the World Health Organization, half of all mental health illnesses begin at age 14 or at least able to be detected from around age 14. Most cases, though, are undetected and untreated. Doctors Without Borders' James Kambaki is here to unpack mental health issues, particularly in Africa. Very good afternoon or good morning to you, James. You have focused on children and adolescents. Why?
I think that is also looking at Africa, where the population, 50% of the population is from young children, young adults. It's actually obvious that mental health issues become more visible. But Africa also lags behind because of the enormous shortages that actually mental health focus is actually being driven to. So our focus now is to actually try as much as possible to shed the light that this should also be a priority, not something that is way kind of like it should be tackled in the future, but it should be a priority now.
And I would imagine with the various conflicts on the go in various parts of Africa, a lot of children are affected by what is happening around them. I'm thinking here of the Chibok girls who were taken in Nigeria in 2014. We began to see some of them coming back after being rescued from the Boko Haram militants. But often there isn't a follow-through as far as assisting them not to recover physically, but to deal with the mental impact of the trauma.
Yes, indeed. And that's also because there's other priorities that possibly when somebody is sick, malaria, other diarrhea disease that takes precedence over this mental illness until it now becomes visible that we can actually treat it. But we should be able to be preventing them. And the situations that's man-made, which is conflict, just exacerbates such problems that children becomes even parents when they're still children. And for us, as Doctors Without Borders, we try as much as possible now to integrate all our activities, especially in emergency phase, and do mental health programs because we think and we see that that is really a situation that needs to be addressed at the emergency phase of our interventions.
But organizations such as yours rely quite largely on donor funding. Are you finding that organizations and individuals who can make contributions are interested in giving particularly to the cause of assisting children in Africa who have suffered mental trauma?
Mostly, we have our donors are interested in what we are doing and actually support our cause. And that's why we are putting focus, a bit of attention more to mental health. And not only Doctors Without Borders doing it, but we want to ask also other partners, governmental institutions, to put more emphasis on this particular issue. Because the severity of this impact, if we impact better a young generation that is in Africa, we're actually building a future of Africa. And that's why Doctors Without Borders is actually asking even more support for mental health issues.
Do we have adequate and credible data on just how many young people are suffering?
It's difficult really to find concrete data. So we talk about world global kind of picture of 450 million people kind of affected by mental health, and 85% of that from low resource settings. So you can imagine the magnitude. 20%, almost 20% of those are actually like never been, taken care of. So we're looking at a situation where shortages are enormous. There's one doctor to a million population in Africa. This shortage of psychologists in Africa. So you can just imagine the magnitude of the cases that has not been either detected or actually being treated. So it's just an urgent need that we're asking now the entire global health sectors to actually look at this a bit more as a priority.
Is there a clear enough breakdown of perhaps the most common ailments that trouble children and adolescents in Africa in particular?
Based on our activities, because we are focusing a lot on conflict setting where also like natural disasters where situations are a bit more severe. Of course, we have trauma-type related issues. But in other contexts where HIV is also prevalent, stigma becomes also an issue that needs to be addressed. But of course, the other organization could actually see more based on the activities or the programs they're running.
So I wanted to talk about funding and the actual ailments. How much of an investment is Africa making towards research on mental health?
We have got no concrete data on that at the moment.
Mm-hmm. And you run, again, on goodwill. And a lot of the doctors who are part of your team are people who volunteer their services and say, I've worked for X number of years and would now like to go into conflict and disaster zones and assist medically. Are you seeing an equal number of psychologists to, let's say, surgeons, for example?
It's quite low. As I said, one psychiatrist to a million population, and psychologists are even less, quite low number, few. For us, we are still kind of recruit more psychologists to actually send them to our projects, our programs. But this number is also still very low. We still have gaps within our projects that needs highly qualified psychologists, because also the cases that we're dealing with is quite, needs high qualification. So we are still seeking for more support, more psychologists to come on board to actually support us and actually offer these services. Shortages of qualified personnel in Africa is just huge.
How do interested psychologists get involved?
They just need to go to our website, www.msf.org.za. You'll click Work With Us, and you'll follow the link there and submit your application, and we'll get to actually send you to one of our projects, and you'll find it quite satisfactory that this could be the only person, the only qualified psychologist that that particular client or a patient have seen in their life.
Okay, James, thank you so much for your time.